My name is Nancy Amato. I'm from Toledo, Ohio. I was diagnosed with pancreatic cancer in September of 2006. I did pursue treatment closer to home initially, and then we heard about the vaccine program at Johns Hopkins.
We originally developed this vaccine as an insurance policy after surgery. We know the surgery can get rid of the cancer temporarily, but we also know that most patients will have recurrence. And so our hope was to be able to vaccinate patients so that we will activate their immune system to fight any possible chance that the cancer might try to come back.
When I come in, the first thing I do is get blood drawn, and most of that is research blood. Because I've already had blood drawn at home that shows that everything's in line, so I am eligible for the vaccine. After I get my blood drawn, I go straight to CAT scan because they need a clean scan before I can have the vaccine. When we leave the scan room, we go right to Dr. LaHayru's office for our appointment with him. And by the time we get there, he already has the report. It's already been read twice. And this is just such a relief to be able to get results that quickly.
Nancy Amato came to our attention about 2.5 years ago, and she actually sought us out, which speaks to the fact that this is a woman who does her research, and we've been very impressed with her knowledge of pancreas cancer, her understanding, and just her ability to get things done, and a very great, articulate spokeswoman for this cancer.
They have 6 different injection sites for the vaccine.
Amato Nancy.
There's 2 sites in your right leg, your left leg, and your left arm. For the next 24 hours, these sites react like an allergic reaction. And you feel like you have a horrible flu, you know, chills and fever and that kind of thing. Personally, I like getting a real bad reaction. I feel like it's working. I feel like it's waking up my immune system.
Within minutes to hours of the vaccine being injected, you can already tell that the immune system is starting to come into the vaccine site. That's the redness and swelling that's seen. Within hours, the immune system is already being activated by the vaccine at that site, and within days, the immune system is now revved up and will circulate anywhere in the body looking for cancer that may be trying to develop.
When I found out I had pancreatic cancer, we were devastated. I wasn't given any hope that I would survive it. It was all very scientific. You know, these are the statistics. If I knew then what I knew now, I would have started at Johns Hopkins.
The greatest pleasure that any cancer researcher can have is to see their patients come back year after year, have their checkups, and be cancer-free. It makes me feel so good to see my patients every year, and they're still doing well, and they tell me about all the little things they're doing, all the big goals they've set for themselves, and cancer isn't even a part of their vocabulary.
You know, I really felt it was very important to set goals. So I set goals to attend my daughter's graduation and to attend my son's 2.5 years later. But it was interesting, after Danny graduated in May this year, I said, I need another goal. So I signed up for a 5K for pancreatic cancer, which anybody that knows me well knows this was ludicrous to do. I mean, I really hate to run. I hate to sweat. I'm really old, and to take up running is kind of silly at this point. But I have children that are all into marathons and triathlons.
You go, Nancy! Woo! You are great! This is like so awesome. Go, Nancy fans! Go, Nancy fans!
good. It felt so good to be out there. I don't want to be the miracle for pancreatic cancer. I really want to be the norm. When I looked at statistics where my disease was, there was no way I was going to live. So you have to hope, you have to fight. So many people in the beginning of this, they kept saying, what can we do? What can we do? Well, you know, at that point, I wasn't getting any good news. You know, people really couldn't do a whole lot, but I said, pray for us. You know, and they did. And I think it's a combination of all this cutting edge research, how I got into this vaccine and the road that led to it. There were all these just quirky circumstances that led me here. But I'm here. I feel like that and these people that have prayed for me is what got me through.